Hello, Professor Lige. In this video, I'm going to perform medical history, dental history, and HIPAA consent form with my two patients. The first patient is Miss Watch, and the second patient is Mrs. Talento. And before having them seated in their working area, I need to review their medical form, dental form, and consent form. Make sure they have signed the form, come up with the questions that they say yes regarding medications, medical dental conditions, visit, or any emergency situation coming up, and then review it with them, ask them specific question, and update any change into EcoSoft if they are returning patients, and if they are new students, so just basically update most of the things. And after that, I will introduce patients to instructor. My first patient is Vivian Watch. Miss Watch, this is my instructor, Professor Lige, and Professor Lige, this is my patient, Miss Watch. She's a student in Foothill College. She returning patients to Foothill College. She comes to clinic every year, and she works as a dental assistant. Next step, I will review a medical dental history and consent form with my instructor. Based on the information the patients provided, she currently doesn't experience any noticeable suspicious medical condition. Her last dental visit was on April 19, 2021, and she was there for dental cleaning. She had bi-wing X-ray on April 19, 2021. So today she's here for routine dental cleaning as well. She brush her teeth 2 times per day and floss her teeth 1 time per day, and brush teeth with crust. She use mouthwash 3 times per week, and some habits, daily habits that we need to pay attention is that she often eat candy and eat sweet. She drink soft drinks once a week, and she rarely drink alcohol. She also had orthodontic treatment started in 2009 and ended in 2012. She doesn't have any medications at this time, so based on the information she provided, her condition does not affect dental treatment, and based on information provided, so we can come up with a proper plan and also recommend her with proper oral hygiene. My second patient is Mrs. Talento. Mrs. Talento, this is my instructor, Professor Lige, and Professor Lige, this is my patient, Mrs. Talento. She's a student at Foothill College. This is her first time at Foothill College dental office. She's studying dental hygienist, and she comes to clinic every year. After that, I will review and go over the medical forms, consent form, and dental form with my instructor. So based on information she provided, she had pregnancy surgery in 2020. She has some serious medical conditions that we need to pay attention. They are asthma and breathing problem due to environment factor, due to smoke and fires occurred in Bay Area last year. She currently using Abudero as needed, Advair 2 times per day, and Montelukast as needed. So for patient taking Montelukast, there's no dental consideration, need to be focused, but because the patients also taking Abudero and Advair to treat asthma, there are a few adverse reaction events that might happen. So some adverse events that might happen, such as localized infections with Candida albicans, occur frequently in the mouth and pharynx with repetitive use of oral inhalers of corticosteroid. This infection may require treatment with appropriate antifungal therapy or discontinuance of treatment with corticosteroid inhaler. And also the patients taking Abudero, so there are a few adverse effects that might related to dental treatment. So some adverse effects such as unpleasant text, glossitis, sinusitis, and xerostoma or tongue ulcers that have been reported. She's also report that she's sensitive. Her entire teeth is sensitive to hot and cold food. She is often chewing gum, rarely eats candy, drink soft beverage like once a week. Her oral hygiene seems very good. So she has no alcohol, use mouthwash once a day, brush her teeth twice a day with crust, and she had full mouth X-ray on May 24, 2021. So her last dental visit was on July 20, 2021, and she's here today for dental cleaning, routine dental cleaning. So she also reports that she had problem of cleaning her teeth at night, which effect, which made her to fix her feeling often. And that could be all about this patient.